Good morning, my name is Marco Valtierra, and today I'm going to be doing an HEE&T exam. To help us here is Carlos. He's going to be the patient today. So to start off with, I'm going to introduce myself and tell the patient what I'm doing. Mr. Carlos, good morning. My name is Marco. I'm going to be doing an HEE&T exam today. Is that okay with you?
Yes.
Okay, so now I'm going to put on some gloves. And today we're gonna be looking at your head and your nose, your mouth, and your ears, okay? So we're gonna start with the head and neck, and we're gonna start by looking at the head and the hair, the scalp, looking for any hair loss and looking for any skull abnormalities such as indentations or deformities. We wanna look at the scalp for any lesions or moles. Okay, and now we're going to be doing we're going to inspect the symmetry of the head, of the face, look at facial expression, and we notice any involuntary movements or edema. And we're going to be checking cranial nerve number 7. Mr. Carlos, can you puff up your cheeks? Okay, and can you smile for me? Okay, can you raise your eyebrows? Okay, now with this we're looking for any asymmetry. Now we're going to palpate the cervical lymph nodes. We're going to start here with the submental, right below the chin. We do this in a circular, gentle motion. Now we're going to go to the submandibular, right here in the middle of the mandible. Okay, and now we're going to go to the preauricular, right here in front of the ears. And we're going to go to the posterior auricular, right here behind the ears. And now we're going to go to the tonsillar, right here at the corner of the mandible. And we're also going to look at the occipital, right here at the base of the skull. And we're going to be looking at the here on the side of the neck to the superior cervical, posterior cervical, and supraclavicular, right here on top of the middle of the clavicle. Okay, everything is normal there. Now we're going to be examining the trachea. We look for any deviation abnormalities. We're going to use our stethoscope and hear for any stridor. Can you take a deep breath, please? Okay, everything sounds normal. Now we're going to look at the thyroid gland. We can palpate it and make sure there's no goiter or any abnormalities there. And we're going to go behind the patient and ask the patient to swallow some water. Okay, and we're here palpating and making sure there is no, making sure it ascends as it's supposed to. Okay, now we are going to be looking at cranial nerve number 11. For this, we ask the patient to shrug their shoulders against resistance and move their face to the side against resistance. Okay, and we're going to be doing cranial nerve number 5. And we're going to ask the patient to identify which side of the face we're touching and whether it's soft or sharp. So close your eyes, sir, and can you tell me where you feel that?
Left side, soft.
Okay, and we're gonna do it again.
Forehead, sharp.
Okay, what side?
Right.
Okay, so everything is normal there. And now we are going to be looking at the eyes. And we're going to start with a general assessment of the eyes. We're going to look at the eyebrows and see there's no patches or scaliness. Now we're going to look at the eyelids and the eyelashes. And we're going to look for any styes, lesions, edema. We're going to be looking at the general position and alignment of the eyes and make sure there is no exophthalmos, anything like that. And we're going to be looking at the corneal light reflex, which is present in him. And we're going to be looking at a little bit closer at the conjunctiva and sclera, making sure there is no drainage, redness, jaundice, anything like that. And we're going to be looking at make sure there's no swelling or excessive tearing, which could indicate abnormalities in the lacrimal apparatus. And then we're going to look at the iris, cornea, and lens. Make sure that there's no opacities or cataracts, things like that. And we are going to be looking at cranial. So the whole eye assessment is pretty much assessing cranial nerves 2, 3, 4, and 6. So for cranial nerves 3, 4, and 6, we're gonna be assessing extraocular movements. We're gonna test the 4 quadrants and the midline, and we're gonna do this by asking the patient to follow the pen. We're gonna go on the midline here, and then up, down. Make sure you don't move your head, please. Okay, no abnormalities there. And we're going to be also making sure the patient follows it to the tip of the nose to test for convergence. And we are gonna be now doing cranial nerve number 2, which is, for this one we start with the Snellen chart, testing for visual acuity. We stand 6 feet away from the patient and ask the patient to read the smallest line that they can read.
LTFBH.
Okay, now cover your right eye. Try it again.
LTFBH.
Okay, now cover your left eye and try again.
LTFBH.
Good, so 20/20. And now we are going to be looking at the deeper structures of the eye and the optical nerve, and to do that we are going to use an ophthalmoscope. First we stand 6 feet away from the patient, an arm's length away from the patient. We look for the red light reflex. Once we find it, we get in a little bit closer and we look at the optic nerve, the vessels in the eye, and look for any abnormalities there. Ideally, you want the light a little bit dimmer so you can see better for this. And that concludes the eyes. Now we're going to be moving on to the ears. We also start with a general inspection of the ears, making sure there is no lesions, deformities, lumps. We can also palpate the auricle, the trachea, and the mastoid areas, making sure the patient doesn't have any tenderness in those areas. And now we look a little bit deeper with the otoscope. And with these, we look at the ear canal. We look at make sure there's no drainage, redness, swelling. We look at the tympanic membrane, make sure there is no rupture, bleeding, anything like that. And now we are going to look at cranial nerve number 8. For this, we stand about 6 feet away from the patient, and we whisper some words. I'm gonna ask Mr. Carlos to cover his right ear, and I'm gonna whisper a sequence of 3 letters and numbers, and he has to repeat them.
896.
So there is no abnormality there. And then we'll do it on the other eye, on the other ear too.
6 and 6/4.
Yes. So if there were any abnormalities, we would use a tuning fork. We would do Weber test, put it on the top of the head, and then we could also do a Rene test, checking for the air conduction and then bone conduction to assess for sensory neural versus conductive hearing loss. And now we are going to look at the nose. Again, we look at the general nose, make sure to look at the surface, looking for asymmetry, deformities, test for obstructions. Can you cover your right nostril and breathe? Are you able to breathe? Okay, now do the same with the other one. You can breathe, okay. And now we can use the otoscope again. And for this, you can ask the patient to tilt the head back a little bit. And we are going to look at the septum and the nasal turbinates and meatuses. We want to make sure that there is no abnormalities there. Now we're going to palpate the frontal and the maxillary sinuses, and we can see that see if the patient has any tenderness there. And we're gonna just now cranial nerve number 1. For this one, we have if you need to do this one, the way you do it is you have the patient close their eyes and identify the smell. So can you please close your eyes here? And then can you tell me, cover your right nostril, and can you tell me what you're smelling? Try again.
Cucumber. Sleepy spice.
Yeah, what kind of spice?
Cinnamon?
Yeah. Okay, now cover your other, and then we're gonna try it again. Okay. Alright, now we are going to be looking at the mouth and pharynx. We're gonna look at the lips. For the general appearance of the lips, is there any dryness, ulcer, cyanosis? We are going to look at the oral mucosa, and we're going to be checking for any white patches, ulcers. Can you open your mouth, please? Okay. And we're going to be looking at the gums too, looking for any bleeding, swelling, the teeth, in between the teeth. We're going to be looking at the top, the roof of the mouth, hard palate, soft palate, looking for any asymmetries, redness, lesions under the tongue, the floor of the mouth, looking for any lesions there. Okay, now we're going to be looking at, also make sure there's the teeth, there's no missing teeth, no cavities, things like that. And we're gonna also, we also can use a little bit of light, and we can assess the pharynx, the tonsils, making sure the tonsils aren't swollen, things like that. The uvula, making sure there is no postnasal drip, things like that. Now if we find any abnormalities on the tongue or the oral mucosa, we can palpate and check for any like thickness or lesions. And we are going to be assessing the cranial nerves now, number 9 and 10. For this one, we have the patient say okay, and we assess for the uvula, making sure it stays midline, and that the soft palate should elevate symmetrically. And we also elicit the gag reflex. I'm not going to be doing that right now, but that's part also of cranial nerves number 9 and 10. For cranial nerve number 12, we ask the patient to stick out their tongue, and we look for any deviation, atrophy, fasciculation there. Okay, and now we're going to be looking, so that pretty much concludes the HENT, and now we're going to be doing the mental health assessment. We are doing the PHQ-9, and for this one we ask the patient a series of questions. I'm not going to go through all of these, but we can go through a little bit. So we would ask the patient if, for example, do you have Over the last 2 weeks, how often have you been bothered by the following problems? Not at all, several days, more than half the days, or nearly every day. So, over the last 2 weeks, how often have you been bothered by any of the following problems? Little interest or pleasure in doing things. Not at all, several days, more than half the days, or nearly every day.
No.
Not at all, okay. And you keep score of this, and at the end you tally it, and you can assess mental health. This is one of the ways you can assess for general mental health. And this concludes our video. Thank you.